there, I'm Mona. I'm going to be your nurse today. The doctor has ordered for you to have a Foley catheter put in place. Can you tell me your name and your date of birth, please? Mr. Gene Bray, 8151. Awesome. Okay, Mr. Bray, this is going to be a relatively painless procedure. You may have a little bit of discomfort, but you shouldn't have any pain. And this is going to allow you to be able to void without having to get up and go to the restroom. The doctor wants you to have one. So it's going to be done sterilely. So I'm going to put your legs in a position. And if you could try not to move and just hold that position while I get it put in place, we'll get you laying back in a regular position as soon as possible, okay? All right, well, I'm going to get the supplies and I'll be right back, okay? So here's my Foley. I'm going to put my trash back right here.
Whoa.
The bed's moving because it's not locked. If it were locked, it wouldn't move. Hi, Mr. Bray. I'll provide for some privacy. I'm back. Go ahead and wash my hands. Get the kit open. Alright. That was very clean. Come on. Golly. Oh, the love. Why, I say. Come on. Alright. Okay. Now here comes the part. We're going to just spread it up to here so he can have some privacy. And we're going to lift your legs here, Mr. Bray. Okay, you doing all right? Okay, I'll try to make it quick, okay? Get the gloves. And make sure and confirm that Mr. Bray doesn't have any iodine allergies, shellfish, anything like that, just because of the prep that we're going to be using. And he does not, so we're good to go. These are not one-size-fits-all gloves. All right. We're going to put the drape down. Doing okay, Mr. Bray? Yeah, okay. And this one is just a duplicate drape, and we're going to go ahead and put this down at the end just to give us a little more working area. Bring everything right here. I'm not going to test the balloon on the Foley. A lot of people say that you do, but it's really not necessary anymore. And some facilities do not recommend doing that, so we're not going to do that. This is our lube. We're just going to kind of lube the end of it here. Okay, Mr. Bray. Now this is going to be this is my non-dominant hand, so I'm going to firmly grasp the penis at the base, kind of lift it up and away. And we're going to apply this. I'm not going to do it just because I don't want to dirty up the mannequin, but we do it in a circular fashion. All the way down to the base. And when we have that adequately prepped, we're going to begin the insertion of the Foley. We're going to feed it in grasping as we advance it so that it doesn't retract. If this were a man and he weren't circumcised, of course we'd have to pull his foreskin down before prepping. We advance until we get urine flow in the bag, and when we see the urine flow, that's when we inflate the balloon. So we'd advance till it was all in there. Then we tug back until we feel a little resistance on the balloon. If he were not circumcised, we have to make sure when we replace the foreskin back down because we don't want that to get constricted. And then we would move this out of the way just so for cleanliness. Then we'd go ahead and take this off first of all. Then we're going to go ahead and tape this, secure this to the leg with a little slack so that if he bends or turns, he doesn't pull it out, causing urethral damage. And then we hang the bag on the side of the bed, clean him up, and that's it. Thank you. Oh, document. Thank you.